Johnson. I'm here to show you the skill of catheter care. Now this skill is shown on another video for a close-up of the private area. You will be able to see a little bit of what I'm doing today, but please go to the skill for the close-up on catheter care so that you can see what we're going to do. Now on this skill, I will be using a bath blanket, a bed protector, a towel. I think I'm going to move my towel over here, a basin, and then I have washcloths, soap, and gloves. And so we'll just get started here. Hi, Miss Jones. I'm Miss Tammy. I'm here to do catheter care. I'm gonna hold my hands up and say hand hygiene like I want you to do on every skill, and pull the privacy curtain. That is also when I will say that I get my water, okay? Then the very next thing I'm gonna do is raise the rails. Now this is one of the main critical steps on this skill, and if you forget to raise your rails and raise your bed, you will fail this skill. So that the rails are up and the bed's going up, I want it at a comfortable position for you. I don't want to see you tippy-toeing or bending over or stretching. So you've got to find that perfect spot for you. I want to lower the rails. Now at this point I'm going to put my bath blanket on. Now I am okay if you want to put your gloves on and then the bath blanket, but I believe in this skill that it does have you put the bath blanket on and then your gloves. So either way is right. Also, when you take the bath blanket off, I don't want you unfolding it here because you just got a risk of touching the floor. Lay it on the resident and unfold it. And I want it all the way unfolded because it needs to cover. Although we won't be turning the resident in this skill, if you don't unfold the bath blanket all the way, when you turn them, you will not be able to have enough coverage. Now also, I'm gonna go under here and I'm gonna pull the sheet down. You can do so just holding on, maybe holding here or here and pulling it down. The straighter you pull it down, the better it is to get it back up. Or you can tuck it under the shoulders, and that way you still have both hands. Now you will only need to go past the peri area, and that will help you too. You don't need to go all the way down to the feet. Then I am going to put my gloves on at this point, and I'm going to expose the area. Now when you're doing this skill at state, I just want you to make just a tiny bit of area. Everything else should be nice and covered. But I'm going to pull this back so you can see a little bit what I'm doing. Then I'm going to get my bed protector, and again I want to unfold it over here over the bed, and I like to get it, if you don't want it all the way open, that's okay, but I want to get it ready so that when I do kind of lift her or turn her a little bit, that it's going to go under there really good. And our goal is to protect the bed right there where we're cleaning, so it doesn't necessarily have to be perfect, okay? So then I'm going to get a washcloth. Now I know on most of the skills, most of my videos that had a washcloth, we do a mitt. This is one of maybe only two that we don't make a mitt because we're working in a very tight area. So I do want you to say, I'm getting wet, and put your soap on it. I'm just going to kind of wrap it around here. So the very first thing I'm going to do is separate the labia. Now it's very important that you use correct medical terminology, and I said labia. I did not say Liberia, and I did not say Libra. So be sure that you know your terminology and you say it because it is a critical part of this skill. So I've got soap, and I'm going to wash around where the tubing goes into the meatus. Now that's on a man or a woman, it's called meatus. So I'm going to gently wash around that area. That's washing, so I'm going to put this washcloth here, and then this is the rinse one, and I'm going to rinse. Now, if it's a male and they're uncircumcised, you will need to pull the foreskin back in order to get to the tubing, where the tubing goes into the meatus. The instructor will either tell you, or if it's just a female, you will know that, but if it's a male, she will tell you whether they're circumcised or not, okay? So I've rinsed gently around that area. Now I'm going to go back to my washcloth. And I love for my students to say washcloth and not wash rag. This is a basin and this is a washcloth, not a bucket and a rag, okay? It's what we wash our cars with. So now I'm going to, I've washed and I've rinsed that area. That is exactly where I want you to hold. So you're securing that. Even though it's anchored, I still want you to hold it there. The state instructor that teaches this or tests this is very picky on this point right here. Now I'm going to wash, just kind of holding it down the tubing, and I'm going to come out here and I'm going to turn to a different part of the washcloth, and I'm going to do that till clean. I'm looking for anything that's abnormal drainage, crust, or secretions that I would report to the nurse. So now that's washed. So now I've got to get the soap off. And so now I'm going to hold again where I washed up here. I'm going to rinse and turn it. And I just want on any of the skills that we're cleaning, always say that you're just going to wash till clean or rinse till clean. Then I'm going to make sure that it is secured to the thigh, that it is not kinked. Sometimes they coil like that, and then that the catheter bag's below the bladder. That is not on that skill, but I think it's important to say. And at this point, I'm now going to take my bed protector out. And as any skill that I've said throughout these videos, when you take a bed protector out or you take a towel out, that is when you remove your gloves. So I'm just going to kind of cover her up, just kind of lift her hip, remove this, roll it inside, put that into the trash can that's right there by your bed, and then remove your gloves before you touch anything else. And then the gloves go in the trash. I'm then going to pull the linen up, and I'm going to take the bath blanket and I'm going to roll it down. And anytime you're taking linen off, you always roll it down and then roll it away, and you always do one piece at a time. And then that goes in the hamper. A lot of times she'll just take it from you and take it away, okay? And then I'm gonna make sure she's comfortable. At this point, I'm going to raise my rails, because if I don't, this is another critical step that you will fail. I'm going to lower the bed, which is very, very critical, because we don't want to leave the resident up in the bed with the side rails up. And then I'm going to lower the side rails, come over here, and I've said this on different videos, but I kind of always want you to walk from the head to the toe to get used to that in nursing. So all the side rails are down. I'm going to make sure she has her call light. I'm going to hold my hands up and say hand hygiene and report and record. Thank you.